If you have shoulder pain and perhaps you're not quite sure what's going on or what you can be doing about it, then in today's video, I'm going to try and explain everything you need to know to help you understand what's going on and what you can do about it. Now, shoulders are a very commonly injured part of the body. It's the most common area of the body I see in clinic. There's many different reasons for shoulder pain. I can't go through them all because there's a lot of causes, but I'm going to go through the most common ones that I see in clinical practice. So the most common one I see is to do with an impingement, so something happening to one of the tendons or the bursa around the top of the shoulder. I also see muscle strains quite frequently, people who have done too much. Then I see frozen shoulder quite a lot, and I'm going to go through all of these in a little bit more detail in a second. Then I also see labral tears, and lastly osteoarthritis. So these are the most common causes of shoulder pain that I see. But what we're going to do is go through some anatomy so you can see exactly how the structure of the shoulder relates to your pain. After that, then we're going to have a look at some movements and some tests that you can do at home. And this is going to help you kind of get a really good idea of what it could be. But what I would say is, if you have got shoulder pain, always go and get it seen by a professional who could properly diagnose you. It might also be worth having a scan, but we'll touch on that in a little bit later in this video. So right now, let's have a look at the anatomy of the shoulder. So the first thing we need to think about when we're looking at shoulders is the anatomy. Now, I get that this is probably not something that you might have a big interest in, but if you know what's going on in the shoulder, then you can relate to how that is with your pain. So I've got two models of shoulders here. We're just going to look at this one here to start with. Now, what we were looking at is both of the shoulders, shoulder blades. So these are the shoulder blades down here. These are your humerus, so your upper arm bones. This is from the front. So as you're looking at me now, if I was to take my body away and just leave my shoulder blades, that's how it would look. So this is the collarbones here at the front. You've got the shoulder blades. And then if we swivel it around, this is the back side of the shoulders. So looking at this one here, what we can see is the blue area here. This is cartilage. And if you could just about make out, there's some striations here. This is where the capsule would be. Now the capsule basically holds the joint together. So it seals the joint. So we've got the cartilage of the humerus. Inside, we've got the actual joint of the scapula. Around that, or around this bit that's been cut away, is something called a labrum. You can't really see it on this model, or not that easily anyway. The labrum basically just adds a little bit of extra depth to this joint. So one of the things that can go wrong is this labrum is quite a soft structure compared to the boniness of the rest of it. The labrum can become torn. So quite often it can be the upper part at the front or the upper part at the back. This can be known as a slap tear. Then looking above, we've got where the collarbone comes in and meets the shoulder blade. So this is called the acromioclavicular joint. So this is the acromion. This is the clavicle. So the acromioclavicular joint. So the ligaments in here can become strained, or the joint itself can become arthritic. And we'll cover the movements that can diagnose the difference between this or this causing your pain. Then at the front of the shoulder, you might just about be able to see this white line coming down here, this white bit of elastic. This represents your bicep tendon, or one of the bicep tendons. Quite commonly, the bicep tendon can become irritated, although in my experience, it tends not to be the most common area that's affected. So I've mentioned we've got arthritis of the joint, we've got joint problems up here, we've got tendon problem at the front. Then if we add the muscle back in, then I can show you what could go wrong with the muscle. But before I do, what I want you to just pay attention to is this little tunnel through here. Now, this tunnel is quite commonly where we get a lot of impingement. So if we look at this model, what you can see is this green blob. This green blob basically represents something called a bursa. A bursa is a fluid-filled sac, and it allows movement between two structures. So it allows two structures to slide across each other without friction. So a bursa can sometimes become inflamed, and underneath that, which you can't see on this model, is a muscle called supraspinatus. So this red part here is the muscle of the supraspinatus, and then the tendon comes through and attaches onto the top of the shoulder or top of the humerus. So we can get impingement in this area. Now, if you were to lift up your arm like this, that would be like me doing this on the model. So as you can see, or hopefully you can see, you've got this tunnel right here. And as you lift up the arm, this space becomes a lot smaller. So if there's any irritation, if there's any swelling around this area of the tendon or of the bursa, then as you lift up your arm, that can become painful. That will be clinically relevant in the test that we're going to do in a few minutes' time. While I'm at this stage of the shoulder joints, the other thing that can happen in this area, and I've done another video on this, is frozen shoulder. So as I've mentioned, we've got the joint capsule. You can see it is slightly better on this model. So we've got this kind of white striated area here. It goes all the way around to the back, and it actually goes over the top as well. This is called the capsule, and this can become shortened and restricted, leading to something known as frozen shoulder. So if you want to know more about frozen shoulder, check out this video just here. Okay, so now I've added in some of the muscles back onto the shoulder. Now there's 4 muscles here. This is known as the rotator cuff. So there's 4 muscles of the rotator cuff. Collectively, they add stability to the shoulder. So all of them pull inwards, causing more stability at the shoulder joint. Individually, they have different functions. At the front, we have the subscapularis. This aids in internal rotation. So if you have your hands out in front of you and you take your hands in, that's one of the assisted movements. At the top, we've got the supraspinatus, and as you can see, it's coming through that tunnel and attaching to the top of the shoulder. This aids in abduction of the arm. Then as we come around to the back, we've got the infraspinatus, quite a big muscle, and then the teres minor. Both of these aid in external rotation of the shoulder and also slightly adduction of the shoulder as well. So quite commonly, the rotator cuff can become torn. I actually tore my rotator cuff when I was at school quite badly, and it took me years to overcome. But the good thing is, because it was muscle, all it needed was some very deep tissue massage. Eventually it did get better. And then on top of that, you add in the strength training and it's now fine. So muscle strains is quite common, more so with the infraspinatus or the teres minor. Underneath that is where the teres major would attach, but that's not part of the rotator cuff. Then the supraspinatus, so this muscle at the top, this is one of the more commonly irritated parts of the shoulder. So again, impingement of the shoulder is either to do with the supraspinatus or the bursa, as I showed you earlier. Now that's quite common. So impingement, bursitis or supraspinatus tendinitis. We'll go through the test in a minute so you can diagnose, or so you can get an idea of whether there is an impingement. One other thing that I didn't mention earlier as a common cause of pain is calcification of the tendon, so calcific tendinitis. So quite often this tendon, so where it's red, this area around here is probably going to be white. This tendon can become calcified or can have calcified deposits within it. That alone can cause impingement. Also, where we've got this acromion here, we can have variations in the angle of this acromion. So right now you can see it posteriorly sloping, so backward sloping. Sometimes it can be more flatter, and sometimes it can also slope more towards the outside. Sometimes, in rarer occasions, it can be slightly anteriorly sloping. So depending on the slope of the acromion, that can cause impingement or predispose you to more impingement as well. So that's some of the common issues with the shoulder. Let's now have a look at some movements and some special tests that might be able to help you diagnose or get an indication of whether it's an impingement, a labrum, frozen shoulder, a acromioclavicular joint, and so on. So the first thing we want to look at when assessing shoulder pain is what is the range of motion like compared to the good side. So if you're at home, I want you to try this right now. So stand up, lift your arms all the way up into full flexion. Can both sides move equally? Can you get your arms up close to your ear? If you can do that one side but the other is in front, then that shows some major difference between both sides. Then go into full abduction. So taking your arms out to the side, all the way up to the ceiling and back down. Note where you feel pain. So this is known as a painful arc. This is a test I do. So again, let's assume we've got pain in the left shoulder. Usually, if there is a impingement, we would expect pain to start from around, 40 degrees to about 120 degrees. So this is where the arm is at its most compressed within that tunnel. Do you remember that tunnel I showed you? So the arm is that tunnel is most compressed around this region here. So anyone with an impingement will usually feel pain somewhere in this range here. But once they've gone past this range and come up to full abduction, usually that pain eases off. So that's a really good indication that that's probably some kind of impingement within the shoulder. If, however, while coming up, there's no pain until they get to about 120, 140 degrees, and then there's pain at the top, sometimes that can suggest that there's some kind of compression or joint problem within the acromioclavicular joint, because that's compressing that joint together. But in my observation also, up here, especially if someone's tight in the lower muscles, you can get pain, but it's actually not a problem. So what's happening is these muscles are working so hard to get you into this position that they're just contracting too hard and causing some pain. But actually the cause is the tightness in the shoulder lower down. So it's stopping you from coming higher than this. So then these muscles are working extra hard to pull you up here. From there, we then have a look at what's called the scratch test. So what you're going to do is bring one hand, so start with the good hand, bring that behind you, up your back as far as you can go. Make a note of how far that goes, or take a picture and bring that down. Then do the same on the other side and see how far you can go the other side. In a previous video I noticed that one side was significantly lower than the other. So the arm that goes lower, or that can't go up as high, is often indicating a lot of tightness around the front of the shoulder. So this is ideally what you're looking for, this kind of range. But quite often people struggle to get higher than this, or anywhere around here. Or people start trying to move their shoulder, hitch their shoulder back and sort of wriggle it up to get into position. So that suggests that there's a lot of tightness in the shoulder, particularly with rotation. Now, if you've got a frozen shoulder, you probably won't be able to even get your arm or your hand up above your buttocks. So that is when I suspect frozen shoulder. If it goes higher than buttocks, generally speaking, I'm not considering frozen shoulder. Now, if we want to consider the possibility of a labral tear, what we need to do is bring the arms up, or let's start with one at a time. So if you bring the good side up first in front of you, bring it across your body, and then turn your thumb down as much as you can. With your other hand, put some pressure on the hand, on your arm, and try and resist you pushing down with the good hand, or try and resist you pushing down with this hand, and note if you get any pain. If you do, try turning your hand all the way around the other way, so your palm is up, put some pressure down and try and resist. If it's painful with your thumb down, but not with your hand up, that can be possibly indicating a slap tear or a label tear. Now, of course, you can also do external rotation. I don't find this one quite so informative. It doesn't really rule in or rule out much. People with frozen shoulder often are very limited in the range of movement they have in external rotation, but most other shoulder issues are not really aggravated by external rotation movements. So for me personally, I don't find them that informative, although looking at left to right, if one side goes completely out and the other side only moves slightly, then that does show obviously there's restriction and that needs to be worked on. If we're looking at the supraspinatus or impingement or bursitis, or even calcific tendonitis, again, pain in this kind of region would often cause pain. If someone has pain as they're going up into full abduction, what I'll often then do is follow that on with what's called the empty can test. So you bring your arm up into about 90 degrees, take it slightly forwards, then turn your thumb down. If that causes pain, that's known as a positive test. If that does cause pain, then you perhaps don't need to go on to the next step. But what I would often then do is apply some pressure down onto this arm and get the person to resist. If that causes pain, then that's a positive test for the empty can or active resisted empty can. So that would often indicate to me a supraspinatus tendonitis, a bursitis, and occasionally some kind of calcific tendonitis. Now, a question I frequently get asked is, should I go and get my shoulder scanned? The advice that I generally give is try treatment first, or try stretching, try moving, try and get the pain down. If what you do works and if what you do is helping to reduce the pain and improve your shoulder, then there's probably not much of an urgent need to do so. However, if what you're doing seems to be making your shoulder problem worse, or it's not getting any better, then I would suggest it's probably worth having a scan just to rule in or rule out certain problems like tendonitis, tendon tears, calcification, the joint problems themselves. So a scan can be quite useful if problems are getting worse or no better. Then go and get your shoulder scanned. Okay, so now we've gone through the anatomy, we've gone through the movements and the tests. Maybe you've got a good idea now of what could be going on with your shoulder. Now, if you have just injured your shoulder, there's a good chance you are in acute pain. So acute pain is when the pain is really significantly high, say a 6, 7, 8 out of 10 for pain. This stage is what I would apply phase 1 to. So if you've never heard me talk about the phase 1, phase 2, phase 3, essentially what it is phase 1 is all about reducing pain and inflammation. Once you've done that, the next phase is often to go into improving your flexibility and mobility. Lastly, once you've gone through that phase, the next phase is to re-strengthen your shoulder, strengthen and stabilize your areas, your joints. If you want to know more about these 3 phases, I've got a free ebook which goes into much more detail about all of this. So all you need to do is click on the link in the description below to get your free copy of my ebook. So if you are in phase 1, first thing you've got to do is just get the pain down. There will be no point in stretching or strengthening because all that's going to do is make the problem worse. So phase 1, you've just got to move. Move your shoulder as often as you can. Now, if bringing your shoulder up to about here causes you pain, then all of your movements that you do should be less than that. So we can possibly go to here. So here's causing you pain. Here is not causing you pain. So what I would suggest is you moving your shoulder throughout the day into this kind of range where you're not in pain. Then you can also apply cold. You can take anti-inflammatories. Always speak to your pharmacist or your doctor about medications. And then just wait for the pain to start going down. That's all you can really do in phase 1. Now, as your pain starts to come down, we're starting to move in towards phase 2. Phase 2 is about restoring the flexibility, mobility. So this is the phase where we start stretching. This possibly could take weeks or months. So it's all of these phases you've got to be patient, you've got to be consistent with. So phase 2 is about restoring your flexibility and mobility. Once you have noticed an improvement in your flexibility, then we start strengthening, and that's phase 3. So rebuilding your strength and stability. Now this phase is perhaps, in my opinion, the most important, because most of my patients tend to avoid strengthening. When they start feeling better, they think that the problem is gone. But actually, unless you strengthen, the shoulder is just not going to be stable and it's not going to be strong. So the problem can still come back. So it's really important that you do focus on strengthening. If you're in phase 2, I want you to go and watch this video over here. This video is going to cover the most important stretches for your shoulder, for the most common shoulder problems. Once you've done that for a period of time, then you can either progress to more advanced stretches, or you can start to rebuild that strength and stability. But right now, all you need to do is go and watch this video right here.